I call the member for Gilmore.
Thank you, Deputy Speaker. Well, before I was elected in 2019, people in my electorate of Gilmore told me loud and clear how hard it was to get in to see a GP. There was huge concern about retiring GPs and no one to replace them. In many cases, existing GP books were closed. You can imagine, with one of the oldest demographics in Australia, this was a huge problem. Not long after I was elected in 2019, the Coalition Government axed the distribution priority status, meaning overseas trained GPs would no longer come to our area. This was devastating and saw a further decline in GP numbers. One busy practice told me recently how they had lost many doctors and were down to 3, with wait times blowing out to 4 to 6 weeks. When I asked the Coalition Government at the time about this, I was told that our area had too many doctors. Can you believe that? Too many doctors. This was insane. And in regard to the DPA status, they said that will never change. And so I set out, along with our community, to campaign to have that DPA status reinstated. And, Deputy Speaker, finally we won. But that was just the start. Medicare was broken. I want to thank our local GPs, nurse practitioners and GP practice staff that have been pivotal in helping shape health policy that puts primary care on a path back to where it should be, front and centre. And I'm pleased to say that after 9 long years of coalition cuts and neglect, the Albanese government is making Medicare stronger for all Australians. The 2023 federal budget builds a stronger Medicare so all Australians can access the health care they need, no matter where they live or their bank balance. Our historic investments in Medicare delivers the largest ever increase to bulk billing incentives, making it easier for people to see a bulk billed doctor. This is an historic $3.5 billion investment, which triples the bulk billing incentive and is an immediate injection to support patients and general practice, and it will strengthen the heart of Medicare bulk billing. Deputy Speaker, this largest ever increase to the bulk billing incentive in the history of Medicare will provide a benefit to around 90,000 people in Gilmore, helping people access a GP to get the health care they need while easing the cost of living, just like people told me. Just this past week, I had the honour of having the Assistant Minister for Health and Aged Care visit Nowra. We visited the Junction Street Medical Practice, where we talked with GPs and nurse practitioners. We were told how the federal budget and its measures to strengthen Medicare had brought back hope and confidence into primary care. Deputy Speaker, we're also delivering cheaper medicines, halving the cost of medicines and halving the number of visits to the doctor and pharmacy. Around 49,585 people in Gilmore will be able to buy 2 months' worth of medicine for the price of a single prescription for more than 300 common PBS medicines. This will halve visits to the GP and pharmacists, saving people up to $180 a year for every eligible medicine they buy, while reinvesting every dollar the government saves back into our community pharmacists so that our trusted pharmacists and pharmacy staff can deliver even more services. This is more great news for people in Gilmore. Less visits to the GP frees up GP appointments for those that need them most. Locals know where people end up if they can't get into a GP. They end up in the emergency department of our local hospitals, putting more strain on our overburdened hospitals and health workers. And if our aged care residents can't access a GP, they end up in the emergency departments too. Bed block, that's what it creates. Cheaper medicines from 1 September is not only good for the hip pocket by easing the cost of living, it helps those most vulnerable who are more likely to skip medication because they cannot afford it. Deputy Speaker, I have never forgotten what people right across my electorate of Gilmore told me about the need to be able to access a GP and health services. Strengthening Medicare is not an easy fix. It's not like a road with potholes you can see and feel every time you drive through them. It's real people, real lives, real health and ill health. I want to thank everyone in my electorate that has contributed to strengthening Medicare. There's more to do, but we're up for it.
The question